Welcome everyone to today's talk. We're going to be speaking about the approach to congenital and acquired hearing loss and its management. It's usually a topic that we give to fourth-year medical students at our university. These are the objectives that we will be covering. And for the ease, we're going to start with the anatomy. I'm not going to go into deep details, but just a quick review that is beneficial for the topic of today. So to start, you know that the ear can be divided or classified, if we can say, into three parts, which is the external ear and then the middle ear. So the external ear, the middle ear, and the internal ear. The external ear, which is the pinna, the auricle, and the external auditory canal. The pinna and the auricle are the same name to this external part of the ear that can be seen from the head. And this is the external auditory canal. And it has two parts, one bony and one cartilaginous. And then we have the middle ear starting from the tympanic membrane, and you can see the ossicles and reaching to the oval window. The oval window is not shown here, but it's where the stapes, which is one of the ossicles, is connected to the internal ear through. And then we have the inner ear, which is made up of the cochlea, the cochlea and the semicircular canals. So as we have said, external ear is the auricle or the pinna, external auditory canal, and then the middle ear, starting from the tympanic membrane, including the ossicles, malleus, incus, and stapes, ending at the oval window. Now we go deeper into the inner ear, which is made up of the cochlea and the semicircular canals. Okay, if you want to classify a hearing loss, we can classify it according to the onset, the anatomy, the severity, and the type of the patient. Starting with the onset, hearing loss could be congenital or acquired. Congenital happening by the delivery of the baby or the newborn. Acquired could happen anytime during the life of the patient. Can be classified according to the anatomy, which is the most common, and that's what we're going to be using. Either conductive hearing loss, sensorineural hearing loss, or mixed hearing loss. We're going to be talking about them shortly. And then, of course, the severity, mild, moderate, severe, profound. I'm not going to speak a lot about the specific range from where we say mild, from where we say moderate, from where we say severe, because it is different from reference to reference. So whatever or whichever your hospital or your university is using, just go with that. You just need to know for now, for this lecture, that there's a mild, moderate, severe, and profound. Now, depending on the type of the patient, there is the organic conductive hearing loss, which there is a cause, anatomical or physiological cause that we can point to. Malingering types of patients who are patients who don't actually have an organic type of or an organic issue. So we call them malingering patients. Now, when we come to the sensorineural, we can subclassify sensorineural hearing loss into sensory and neural. Sensory is when it's related to the cochlea, the issue or the problem or the disease or whatever is related to the cochlea, and neural when it's related to the nerves, whether it's peripheral nerves or central causes. Peripheral nerve that's responsible for hearing is the vestibulocochlear nerve, which is the cranial nerve number 8. Now, as we said, we're going to be talking about the conductive hearing loss, the sensorineural hearing loss, and the mixed hearing loss. Mixed hearing loss is usually the combination of conductive and sensorineural hearing loss together. So we're not going to talk specifically about types of mixed hearing loss, maybe later, but for now we're going to start with the conductive hearing loss. So conductive hearing loss is the hearing loss that happens if there is any problem starting from the external ear, external auditory canal, any problem or any issue or any disease in the middle ear. So it's any interference with conduction of sound to reach the cochlea, starting from the external ear down to the oval window. Again, it could be in the external ear, it could be in the tympanic membrane, ossicles, any other middle ear structures. So to subclassify the conductive hearing loss, we could face patients with congenital conductive hearing loss or acquired conductive hearing loss. The causes of congenital conductive hearing loss is, of course, we cannot only, it's not only limited for the following causes, but I hope this can give you an idea. So meatal atresia. Meatal atresia is when the external auditory canal does not develop embryologically, so it's atretic, so it's not recanalized. So basically the patient don't have an external auditory canal that is canalized, it's solid. And then stapes foot plate fixation. I think the disease is explaining itself. There is the foot plate of the stapes, which is one of the ossicles, is fixated to the oval window. And then the malleus head fixation, again, fixation of the head of the malleus. Or ossicular discontinuity, the malleus, incus, and stapes are not connected together in a way that helps the sound to be conducted. So we call it ossicular discontinuity, or congenital cholesteatoma, which we will be talking about in another presentation. Now, causes of acquired conductive hearing loss. So the ones that are related to the external ear. So we started talking here about the acquired causes of conductive hearing loss. Causes related to the external ear includes the wax impaction, which could be one of the most common causes of conductive hearing loss or acquired conductive hearing loss. Any foreign body in the ear or the external auditory canal. Furuncle, which is an inflammation of the hair follicles. And then any swelling in the external auditory canal, or the external ear can be causing hearing loss, because there would be a blockage of the transfer of the sound waves down to the cochlea due to the swelling. And then any benign or malignant tumors of the external ear, again the same mechanism or idea of swelling. The most common cause, as we said, could also be the wax impaction, at least in my practice and at our country. Now we come to the middle ear causes of acquired conductive hearing loss. Causes due to the tympanic membrane perforation, whether it's a traumatic or infective cause leading to perforation of the tympanic membrane. Of course, if the tympanic membrane is perforated, sound will not be optimally transferred. Now, any cause of fluid into the middle ear, for example, acute otitis media, serous otitis media, or hemotympanum, which means blood in that middle ear. Now, middle ear masses as benign or malignant tumors, ossicular disruption due to ossicular trauma, chronic suppurative otitis media, or cholesteatoma. Ossicular fixation due to otosclerosis, tympanosclerosis, adhesive otitis media, and then Eustachian tube blockage or dysfunction, which will cause retracted tympanic membrane and complicated as serous otitis media, the Eustachian tube dysfunction. So that's it for the conductive hearing loss. I hope to see you soon for the rest of this presentation. Thank you so much for listening.